Thanks very much, Tracy. Next slide, please, Claudia. So my name's Anne Hunt. I'm the leader, local area contact for Cambridge and Peterborough. And we identified cases of historic abuse in a number of our leader reviews during last year. And so contacted Libby to come and offer us some training, and the training that she offers and the service that they offer in Cambridge is quite a unique service, and so we really wanted to amplify this topic and bring it to lots more people. So I'm going to tell you about a lady whose life and death we reviewed. I'm going to call her Alex, which isn't her real name, but just to protect her identity. Alex was a white British woman who died aged 59. She had Alzheimer's disease in the context of dementia, and she had a moderate learning disability, but was very active. And leader reviewers look at GP and social care records, hospital records if necessary, and we speak to people who know that person very well. And so the pen portrait in this case was told to us by her sister, who was very close to her. So she said Alex was a very fun-loving person who could be challenging at times. She loved comedy shows and would use their catchphrases like "You plonker, Rodney." She was very active, enjoying swimming and horse riding. And up until the age of 42, Alex had lived with her mother. But following concerns by her sister and a friend, Alex was removed from the care of her mother due to abuse and neglect. And this came to light during the course of the leader review. It wasn't the reason for her death. She had been admitted to hospital in her sort of late stages of her life and diagnosed with bronchopneumonia. When she wasn't responding to treatment for sepsis, she got transferred back to her own home and died. And on the face of it, if we just looked at mortality reviews, she had a very good death. She had palliative care. She had 24-hour care package in her own home to support her with her dementia, to support her with her learning disability. But actually, when you look back at that age 42, being removed due to the abuse and neglect, the impact that had on her life was quite profound. So there was physical abuse and neglect, and a safeguarding referral was made, and the police investigated. All appropriate actions appear to have been taken at the time. The leader review can't go into sort of like examining whether the decisions made were appropriate, but it certainly appeared at the face of it. And Alex was interviewed telling the police that she wanted to stay with her sister and didn't want to go back there, meaning back with her mother. And she did live with her sister, she did move. But bear in mind, her sister was her biggest advocate and was very involved in her life, and the person of trust. It took her sister months to get what she called the full tale from Alex. And no formal charges were brought following the police investigation. And according to her sister, this was because Alex was deemed an unreliable witness because of her learning disability. This is her opinion. We can't verify the decision making, but we're just reporting what was said. But it just shows the difficulties of identifying abuse and reporting it and taking any action. And just the impact that then had on Alex's life. So she did move into supported living, but she had very challenging behaviour, spitting and punching other residents. And this was deemed to be related to PTSD. The PTSD related to the neglect and abuse that she had suffered at the hands of her mother. So that led to that placement breaking down. And 4 years after she was removed from her mother, Alex was sectioned under the Mental Health Act and diagnosed with a depressive disorder with mixed affective paranoid and post-traumatic stress symptoms with challenging behaviours. And so the following stay in mental health care, she then moved into this house next door to her sister, and lived there, satisfactorily with a care package. And when she developed dementia, her sister actually said that calmed some of her behaviours, but some of her behaviours were triggered by anxiety, some were triggered by the PTSD. And so, what makes this domestic abuse is that she was in a relationship, as in it was a family member that perpetrated the abuse. So, domestic abuse is often an intimate partner, but not always. And the real sort of pivotal difference with this case is that her sister, being a strong advocate, and her willingness to raise a concern really identified the abuse that Alex suffered. And there were no paid carers involved at that point. She may have seen the GP, she was involved in various activities, but it was her sister that picked up on the abuse. And as I said, the police actions were deemed appropriate at the time, but there was no record seen about how that decision making that Alex was an unreliable witness was made. But I think Libby will talk a bit more about sort of the difficulties of taking action as well. And while a lot of the research around domestic abuse points to male perpetrators, the no further action in this case of mother on daughter abuse underlines the likely gaps in research evidence due to the difficulties both of identifying abuse and especially when it's in a caring relationship, because that carer is very often present when other people may have picked up on abuse, and a lot of difficulty securing any action, and therefore a lack of data really in the research. So without further ado, I would like to now hand over to our expert speaker, Libby Swannell-Bell, who is our Shared Lives Domestic Abuse Coordinator from Cambridge County Council. And Libby offered amazing training to our leader team that gave us really great insight into spotting the signs of domestic abuse amongst people with a learning disability or autistic people, and some idea of what they are doing about it in this project. So Libby, welcome and thank you for coming.
Lovely, thank you, Anne. Yes, good morning, everybody. Thank you all for coming. Yes, so I've got the main slot, so you're going to be stuck with me for a little while. However, I hope that you're all getting something from this and some information. So as Anne introduced me, I'm Libby. I am the Shared Lives Domestic Abuse Project Coordinator, which is a mouthful. So I'll be really impressed if anybody can actually remember that by the end. Yes. My role, I run a domestic abuse project based in Cambridgeshire in partnership with the Cambridgeshire and Peterborough Domestic Abuse Partnership, and I'm based with Cambridgeshire County Council, and we provide a service for survivors of domestic abuse with learning disabilities and or autism. So I shall continue. So as Tracy already outlined, obviously we are going to be talking about abuse. We are going to be talking about unfortunately some really quite horrific things. So please take care of yourselves. Your cameras are already off, but if you just need to walk away, turn the screen off for 5 minutes, please do. Equally, at the end of my section, my details will be on the screen if anybody wanted to get in contact contact with me. If something has maybe come up that you want to discuss, and maybe you don't necessarily want to bring it up at our Q&A later, you'd rather have a private discussion, I'm more than happy to be contacted. Leading on from that, if you do have any questions that you would like us all to contribute to, or any questions from this presentation specifically, please put them in the Q&A tab on Teams, and we'll be able to review them at the end. There won't be any hands up. I think there's probably too many of us to be able to do that, but please rest assured that we will answer your questions later on today. So, domestic abuse. What is domestic abuse? I feel like, generally speaking, over the last 5-10 years, we have seemed to have gathered a little bit more understanding, a little bit more common understanding of what that entails. However, I quite like this graphic that you've got on the screen, where it just shows actually exactly, it's not just one thing, it is a whole combination of abuses and how they can all interchange and interlock with each other. Before I did this role, I used to support women and girls who had experienced domestic abuse, and unfortunately, even if people can only themselves identify one form of abuse when they're coming forward for support, I've never met one survivor who's only solely experienced one form of abuse. There's often a combination of the different abuses that are happening. We could often think of it as like an iceberg. You know, the tip of the iceberg is that somebody's maybe come forward with, let's say, physical abuse. But actually, when you peel back the layers, you can understand that there's a whole array of abuses here. And it could also potentially be your place as the professional to unpick that, as 9 times out of 10 people and survivors themselves aren't able to fully acknowledge that full extent of abuse immediately, because that's what the abuse is. So as Anne touched on, abuse is it can be perpetrated by many different people. Obviously, we know where we have intimate partner violence, where it's the person's partner or ex-partner, but it can also be family members. So we had the Domestic Abuse Act in 2021. And that gave us a formal definition of what domestic abuse is. Before then, it was all a bit wishy-washy, but now we've got a unified definition of as to what that is. And within that definition, it explains that the perpetrator has to have a specific relationship with the survivor. And that entails them either being a family member. This can also be step parents, or it can be, married in family. However, it needs to be a part of somebody's family, a partner or ex-partner. So whereby the examples I often give is where, although where we think of domestic abuse, it means the domestic household. If you're living with your flatmates and your friends, it wouldn't necessarily be classed as domestic abuse because there wasn't that existing relationship under that category. It's obviously, it would still be harmful nonetheless, and there'd still be support out there. However, it wouldn't fall under that umbrella of domestic abuse. Equally, within the term domestic abuse, we can see lots of different forms of abuse, like we said about family abuse. Not only that, we can also see child to adolescent to parent violence. So that's where the child, quote unquote, the person's child, whether that be a child or an adult, is the perpetrator, and the parent is the person who has been abused. When we look at these forms of abuse, unfortunately, they are all shrouded with a lot of misconceptions and different sort of ideas compared to what they actually are. So I'll go around this circle a little bit and sort of unpick each one. Emotional abuse and psychological abuse can often be coupled together. This is normal. On a practical sense, I understand why people do that. However, it is good to understand why and how they are different. Essentially, emotional abuse is about your heart, so it's about your feelings, how you feel about yourself, your emotions. your self-esteem, your confidence. And psychological is about your brain, so how your brain is functioning. So this is things like anxiety, PTSD, where we have those trauma reactions that we don't have any control over. That's the psychological, that's the brain. So that's the difference, the heart and the head, essentially. However, when we talk about emotional and psychological abuse, emotional abuse can come in many, many different forms. This can include things such as, calling people names, lowering their self-worth. I'm sure we can all imagine how people can do that, whereby psychological abuse can be more involved in actually changing how that person's brain is functioning. An example of this that we can often see is actually driving dangerously. So where the survivor is the passenger and the perpetrator is the driver, they'll deliberately drive fast to trigger that fear and to trigger that reaction in the brain, whereby someone's in danger, and it goes to that fight, flight, freeze, flop friend. It's instilling those reactions. When we talk about emotional abuse and psychological abuse, a term that we often hear nowadays that's become much more common is gaslighting. I have teenage sisters, so I hear that word all of the time. And unfortunately, when we do see these terms or gain a lot of popularity, it can also dull its meaning, but please rest assured it is a very, very serious thing. And gaslighting is essentially the deliberate change and manipulation of the narrative of what's happened, essentially. How I explain it is if somebody had moved a glass and moved it to the side and pointed out to someone, I'm going to point to Anne because we've all seen Anne now, so we know her face. If I say, Anne, you've just moved that, and I was so serious about it, Anne, you've moved my glass. And of course she hasn't, she's not even in the room with me. However, and that's because me and Anne have a healthy relationship, we know, and everything else, and that's fine. However, if I had known Anne or been a partner with Anne for years and years and years, and I'd constantly told her that, I don't want to say, but if I'd constantly said horrible things about her, I've said things like, no one will believe you, everybody thinks you're stupid, no one, you don't understand the world like I do, you need to listen to me, all of these awful things which we see perpetrators doing, that's what they do all the time, she might be more inclined to believe me. She might be more inclined to go, well, maybe I did move that glass. Gosh, if Libby's telling me I've moved it, I must have. Or I don't want to make her look silly because, I know that would really upset her if I've made her look silly in front of other people. So, or I'll just say, I'm sorry, I didn't mean to, because I know that that's me trying to mitigate the situation. And that's how it can work. So it is psychological abuse, gaslighting, it just falls into that category. However, you need a well-established emotional abuse for it to be effective, for it to work, essentially. And that's where it splits. Sorry, Anne, for picking at you there. I hope you don't mind. Lovely. But yeah, so generally, psychological abuse, it is about how the brain functions and altering that. We'll move on to then physical abuse. This is one that I think we stereotypically see the most of or hear the most of when we're talking about domestic abuse. I often hear, more often than what I should, where people comment, but it's not physical. Oh, but it's not physical. It's not physical abuse, very dismissive, as if that's the pinnacle, when that's not the case. Abuse is abuse. Obviously, physical abuse is very dangerous. However, we describe it as the end point. Where there's not been physical abuse, we say not yet, because we know it will eventually get to that point if it hasn't already. Equally, physical abuse, it can be hard to detect sometimes, although that sounds silly, it can be hard to detect. Essentially, it means it's any non-accidental harm caused on that person's physical body. So that could also include changing or altering medication, either giving somebody too much or not enough, deliberately to try and alter, how their body functions, whether that be it's tablets for their mental health, or it could be their contraception, those sorts of things. Unfortunately, abusers do that, and that's obviously non-accidental. On that person's body. Equally, when we talk about physical abuse, we have our slapping, punching, kicking, spitting as well is included in that. But also where we have domestic abuse and where somebody comes to a professional who and discloses domestic abuse, more often than not that should trigger a DASH risk assessment. Now, if you haven't heard of that, it's I always struggled to remember this acronym because I'm just so used to saying DASH. It's Domestic Abuse, Stalking and Harassment Risk Assessment. Essentially, it's the national standard risk assessment to manage where the risk lies with domestic abuse. So you get 3 categories: standard, medium and high risk. High risk means high risk of domestic homicide, so it gets obviously to the extremes. However, within these sets of questions, one of the questions is, has anybody ever used a weapon against you? And more often than not, people go, oh, not at all. And then you ask, ask them again, because when you think about a weapon, you think guns and knives, right? That's the imagery that we have. That's what you think of. But then if you peel back the layers of that, well, a weapon is anything that's not naturally on the human body that is used to cause harm. So, for example, a lot of the time you get phones, excuse me, are thrown to cause damage and to hit the person. We also see things like keys being used as weapons, glasses, crockery, all of those sorts of things where, although their design is not to be a weapon, they are used as such. And that's just one example of where we've got this predetermined language here when we talk about psychological, emotional, physical abuse. And we all think we know what it is. And yet actually, if we peel back the layers of that, it's far more complex, and those terms and those the language that we use can sometimes create the wrong impression for people who are trying to discuss the abuse with, so it's important that we are being aware of how the language that we're using is being interpreted, especially when we're talking about learning a disability and domestic abuse. And then we go on to technological abuse. This one's very tricky. As soon as we think we understand all the forms of technological abuse, more technology comes out. So we're also always chasing our tail with this one. However, this is a really, really vast category. So it's essentially any use of technology to abuse. It sounds simple. However, it can crop up in many different ways. It can be through things like installing cameras in the home, secretly or non-secretly, but in order to monitor. It can be about using FaceTime to check if somebody is at Tesco's because they said that they were going to Tesco's. So I'm going to FaceTime them and make them prove to me and show the camera around the aisles to make sure that they're Tesco's and they're at Tesco's alone, like they said they were. And they're not going with their friend or going to see somebody. It could also be about tracking. So things like we have Find My Friends app, Find My Phone, all those sorts of things, and air tags now, they can very easily be used to trace and track somebody's movements. And especially things like Ring doorbells. I've got one myself. I like to know who's at my front door before I go there, and I like to know who's at my door when I'm not at home. However, you could very easily look and say, okay, well, Libby's left the house at 11 o'clock and she's back by 11:30. So how far could she have got at that time? Okay, so here's the radius of where I've known that she's been. So okay, so she must have gone to where she said she would have, and those sorts of things. It can be used very maliciously. And that's the thing with technological abuse. It can be easily excused as normal, or it can be easily justified through the technology's normal use. However, we know that it might not be. So that's again another tricky one to find out. Equally, technological abuse, it can be things like social media as well, limiting the person's use of technology, not allowing them social media, not allowing them a telephone, not allowing them to access the internet. It can vary. I know some abusers where they have turned their Wi-Fi on and off. If they're not at home, the Wi-Fi is turned off, and it's controlled by the abuser's telephone, and that's that. You're not having any contact with the outside world unless I'm at home to monitor. So there is a vast, it's really quite vast of where this category covers. But yeah, again, important to recognise that it may not be what it presents itself to be. A ring doorbell may not be just because Libby wants to be nosy at who's at the front door before she gets there. Leading on then to financial abuse, again, these can often be coupled together because we now have online banking and apps and Apple Pay, Android Pay, I can't remember what that was called, Google Pay, so they are intertwined. However, financial abuse can, again, go one of both ways. Essentially, it's about restricting the person's financial freedoms. That can be about accessing their money, taking their money from their bank, making them work, not letting them work. It can also be about the person's benefits, their universal credit, potentially forcing them to go into a joint universal credit. So it's financially tying that person to the abuser, so they're less likely to be able to leave the relationship. If you have money, if you have access to your own finances, you are more able to be able to leave a relationship. You are able to pay for the bus or order a taxi or book a hotel or an Airbnb for a week to get away, for example. But yes, we often see, unfortunately, with learning disability and or autism, it can also include things like the Motability car, whereby that is, because you either get paid the money, don't you, or you get the car. And therefore that's that person's benefit. And we can often see family members and or intimate partners whereby they are abusing the use of that, and they're actually taking that for themselves rather than using it as it should be intended for the person. And then we lead on to sexual abuse as well. So really the crux of sexual abuse is talking about consent. And any form of action, intimate action upon the person where they haven't consented. So when we talk about consent, it's not just about physically saying the words yes or no. I think, this is something that has started to gain a bit more traction, when we're talking about these sorts of forms of abuse. However, it isn't just about saying the words yes. We are 75% body language, and but also it's about actually being able to freely say no. Are you able to say no without having any consequences? If you say no, is somebody going to shout at you? Are they going to hurl insults at you? Are they going to punch you? Are they going to take money out of your bank account, for example? Do you feel like you're able to say no without those consequences? Because if you're saying yes, knowing that there are going to be those consequences, then that's not consent, because it's about having the freedom to be able to do that without consequence, without fear of consequence. Sexual abuse, again, it can be things such as forcing somebody to watch pornography if they don't want to, and also it's about sending explicit images or receiving explicit images without consent from the person as well. That all falls under that category. But as we can see, it's very tricky. Often things can present as one thing and they are the other. And like I said at the start, it's quite often that the person who is experiencing abuse hasn't precisely identified that these things aren't normal. We know that abuse is generational. We know that it follows down family trees. However, that also then means that, you know, this person may have this set as this is their norm. This is what's set as normal in their household as to how to be treated, what to expect, and therefore they are less likely to come forward and explain that the abuse is happening or identify it as abuse. So when we talk about domestic abuse, as I always said, you know, it's surrounded with a lot of misunderstandings, misconceptions and biases. And then we know we live in an ableist society, that's a fact. And unfortunately, we have this sort of middle ground here where this experience lies for people with learning disabilities and or autism, and where they are experiencing their abuse and in that environment, in that context. We know ableism can be you know, institutional, interpersonal, internalized, hostile, benevolent, you know, and it can be very, very tricky to unpick that, whilst then also unfortunately experiencing abuse. And the abuse can often echo those forms of ableism to reinforce that, using those wider forms of ableism to reinforce it, either using it as you know, certain words to say, certain nastiness to say to lower somebody's self-esteem, but it can also be things like benevolent ableism, where it's you know, viewing the person as weak or vulnerable or in need of rescuing, and therefore wrapping the person in cotton wool and overprotecting them and controlling their lives from that sense, which is actually, you know, as we know, is restrictive practice, and it's, you know, it's against their human rights. However, we often see specifically family members, you know, performing this type of benevolent ableism linked to domestic abuse to control that person. And from the outside world, it looks like they're carers. It looks like you know, they are protecting their family member, when actually what it is doing is controlling that person and not giving the person the freedom to live their life how they wish to. And unfortunately, there can be consequences if they choose not. So what we do know about domestic abuse, learning disabilities and or autism is unfortunately very limited. We've only realistically had any research within the last 6 years. So it is fairly new when it comes to research, and we talk about, you know, data and all of that good stuff. We don't know much, essentially. We already know we don't know much about domestic abuse, as what we've already outlined. You know, it happens behind closed doors and often people struggle to recognise it. However, it's even more so when we're talking about domestic abuse and learning disability. However, from what we do know, we don't have any statistics on men, on male survivors. So that's a quick explanation. It's not due to the, you know, it's not being recognised. I suppose formally in the data it hasn't been. However, the support services, particularly the ones that we run, do support men also. However, we are trying to work on getting the data to match it up there with what we understand with women, but unfortunately we don't have that at the moment. So the data that we only do have is based on women and women who have experienced domestic abuse. However, so what we do know with women with learning disabilities, autism or both, are 3 times more likely to experience domestic abuse than their non-disabled peers. We already know in England and Wales that 1 in 3 women will experience domestic abuse in their lifetime. It was 1 in 4 before COVID, and it's gone up to 1 in 3. So this is a really widespread problem. This is it's really, really under recognised, and unfortunately it's happening really, really frequently, and it's going under the radar for potentially the reasons that we've discussed previously. What we do know is where there isn't learning disability and or autism, women tend to, there's an average of 7 years. It takes 7 years of abuse to report the abuse, or to seek support or disclose it to somebody. However, we know with learning disabilities, autism, or both, it is nearly double that. So we know not only is there so much going on, but it's going on for longer, and therefore the impact is going to be far greater as well, and it's been more complex to unpick. We know that domestic abuse is complex. However, we know this is exacerbated through the survivor's care and support needs. Essentially, we have categorised this into 3 different sections. This is the survivors not recognising the abuse, actually to motivate the abuse itself, and then restricting access to specialist support. So, as I said, there is limited research out there. However, there are some pockets of really, really good work. One of which is the Autism project. In 2021, they carried out a survey amongst women and girls with learning disabilities and or autism. And these findings were really quite eye-opening. So 24% thought it was okay for their partner to assault them if they say sorry and buy them chocolates afterwards. 23% thought it was okay for their partner to tell them what to do all of the time. 29% had never heard of the term domestic abuse before. And 100% of the people within the survey didn't know how to contact their local domestic abuse service, which is huge. It really, really is huge. Okay, we can see 29% here that had never heard of the term domestic abuse, but that means that 71% had, and yet they didn't know where to go if they had recognised that, which is really quite shocking. But yeah, 29% had never heard of the term domestic abuse before, which again, it echoes that barrier with language and being cautious about what language that we are using and stripping it right back. As we know, it comes with a lot of imagery, a lot of ideology, and myths and everything else that aren't necessarily true. So it's about working around that and making sure that everybody is aware of what this abuse can practically look like. So what can the abuser do, specifically where we're talking about learning disability and or autism? We know that people use the neurodiverse traits in order to manipulate. We know they can restrict access to wider support networks. Quite often the abusers can be a part of that person's care, whether that be their formal carer, unpaid carer, or just their partner, and generally do take on those caring roles. They can use that. In order to in order to instill that control in all sorts of elements of their life. Things such as, disconnecting people from other community groups or other, friendships, and or potentially even family members. And we can see this happening time and time again, where it's almost shown or delivered as being caring. It's presented as no, I'll do that with you now. You like to do that with me, you can do that with me. Oh no, let's not go there. Well, I know money's a bit tight, so shall we save money and we won't do that anymore, you can stay here. All of those sorts of things, which again, to the outside world seem like they can very much seem justifiable. However, we know that these these phrases and these actions are meant maliciously. Again, the abuser may control the narrative with medical professionals. When we're looking at things like annual health checks, are we seeing that person on their own? Are we seeing them with somebody else? Who are they? Who is that other person? Is that other person, chirping in every 2 seconds? Or are they being very funny about you being alone with the other person, who you're trying to work with? Why is that? I think it's really important to be questioning, even if it is that, it's mum and mum's looked after them for, 30 years, and of course mum's going to be there. It's always great to double check and just again peel back those layers and make no assumptions. Like Anne's case study, there was no one else involved, and it was only where a family member had reported concerns. However, like Anne said, this person would have been going to doctor's appointments, they would have been going to their checks, etc., and it's probably most likely that mum was with her when it happened, and so it's always worth. No harm's going to be caused if you ask too many questions to the right person. If you ask too many questions to the wrong person, then you're clearly, there's going to be an issue, and you're clearly going down the right route, unfortunately. Things again, restricting medication, as we've already discussed. But yeah, using the wider social stigma to emotionally abuse, using those ableist notions and comments in order to further that abuse, to make that person feel less than, in order to control them, and then neglect there as well. So challenges in recognising abuse, it can be about different interpretations of social situations. The research has shown that actually especially where there's an intimate partner and a person with learning disabilities and or autism is going into social situations, their partner is their trusted person. It's helping them navigate social situations potentially. And unfortunately, abusers take this as an opportunity to put themselves on a pedestal and to be able to control the narrative, rather than control the narrative of social situations, rather than taking it as an opportunity for somebody to experience something new. Insufficient education of healthy relationships. Unfortunately, we know this is rife anyway when it comes to our young people and their education around healthy relationships. We know we don't get in there early enough. We know, unfortunately, there is now a huge disconnect and disparity between girls and boys and their understanding of relationships and just where they are socially, and that gap's getting bigger and bigger. However, when we talk then about learning disabilities and or autism, there's even bigger barrier there. I'm going to go back again to the ableism and this benevolent ableism. It's the assumption that adults don't need to know. You don't need to know about healthy relationships, because you're not going to get in one, because we're wrapping you up in cotton wool, and we'll treat you as a child for your whole life, even though you're an adult, and we won't understand that as an adult you may want to have an intimate relationship with somebody, and therefore you're going to need to know how to do that in a healthy manner. Unfortunately, these biases are echoed extremely wide. I have a sister who works in a secondary school, and she runs a SEND provision, and they often have people go into the main school to talk about healthy relationships and domestic abuse and what to do and spotting the signs, etc. However, not once has her department been offered one of those talks, and that's just one example from one secondary school in Cambridgeshire. So it just shows actually how this is so widespread, and how if there's no one talking about these things with them, it creates an opportunity for abusers to come in and to set the narrative if they haven't already. Challenging generational ideology. This is twofold. So this can be when it comes to learning disability and or autism, and that generational ableism. So looking at historically, generations ago, what was what was presumed of people with learning disabilities and or autism, and how that is extremely not the case. However, we know those ideologies can carry out through generations, and then also the ideologies around domestic abuse and what comprehends domestic abuse and what that can look like. And unfortunately, again, we get this sort of centre here where the experience is, and where unfortunately it can prohibit people for recognising abuse. Again, misconceptions of different forms of abuse, as we've already discussed. Professionals potentially reinforcing abuse tactics, and we have come across that quite a few times, unfortunately. And this is specifically around identifying abuse. We have seen where people have tried to disclose abuse, and professionals have seen the person's diagnosis before what they're trying to communicate, and seen it as behaviours, and therefore have been dismissed when actually the person was trying to communicate that they were being abused. However, it was identified as having behaviours, and therefore then gone to a family member or a trusted person as a part of that person's support network, and they have said no, they're fine, they've just got a toothache, and professionals have taken that as gospel, and that's that, we've moved on, when in fact, when we've gone behind the layers again, we've identified that actually that family member was abusing them, and that was them trying to explain to us that they were being abused, and it was completely dismissed, and it wasn't followed up appropriately. And then self-doubt as well. We know in domestic abuse, full stop, especially when you are experiencing psychological and emotional abuse, you are going to be doubting yourself, because your self-esteem is going to be low, your sense of worth is going to be extremely low, and therefore you are going to be doubting your experience. Domestic abuse is really, really difficult, whereby it's supposed to be the person and the people who are as close to you as possible. They are supposed to be the people who you trust the most in the world, and therefore it's really hard to comprehend that person actually doesn't want the best for you. That person is doing this deliberately. They are trying to hurt you deliberately, and you need to do something about that. That's really, really tricky, especially when somebody's telling you the complete opposite for a really, really long time. So that can all of those above can contribute to people not recognising the abuse, and therefore, again, it's down to us to spot the signs. So here we are, signs of abuse, and how to recognise it. So I always show this slide with a little bit of anticipation, because as you can see here, things, eating habits, bruising, lack of money withdrawal, poor hygiene, they can be signs of so many things. I'm sure, I'm not a nurse, I'm not medically trained. I'm sure there are probably, signs for many, many, many different things. And unfortunately, I can't give you the golden ticket to say this is exactly the thing. If you see this one thing, that's going to be abuse, because unfortunately, that's not going to be the case. And again, these are all they're very flexible, in the sense of baggy clothing. Like I said before, I've got teenage sisters. Cool. One of them, if I'd said baggy clothing was a sign of abuse, my goodness, I'd be worried to the heavens, because I mean the clothes that she wears are the most baggy. I mean, she looks like Adam Sandler, but I mean she's great, but she, it must be in fashion again. But so it's not necessarily a sign for everybody. You need to interpret it in the most valuable way that you see. Equally, again, with hygiene, poor hygiene, it's all relative to that person. However, you are working with your people, so you should know them the best. So if you do see these different signs, then they are all something to consider. Essentially, the main take home here is about having confidence in your professional curiosity to take back those layers and to just question what's going on, and don't take everything as what you are told as the surface level. So going back to the study with the Us2 project, the women involved were asked, why is it more likely? Why do you think it's more likely that people with learning disabilities and or autism are experiencing domestic abuse? And this is what they came back with. So some of this we've already discussed, but we've had poor sex education, we may not know it's wrong, we're not listened to, we don't bother reporting, we are often overprotected, our disclosures can be thought of as a part of our disability, we may not know how to report. Again, that continued, the abuse is normal to us, we may lack the confidence, we may have a learned compliance, and some of us have difficulties making relationships. When it comes to this research that I'm discussing, there are actually online clips, YouTube videos of these interviews that were held, and the women involved spoke quite a lot all about this, the weighing up of even where they have recognised domestic abuse, they were weighing up the fact that it was okay that it was happening. And they spoke about how they seemed it as inevitable that they were going to be abused because of their learning disability and or autism. So they saw it as it balanced the scales. So me having a learning disability and or autism weighed it down. There was a negative there. So the only reason why someone would be with me if they can abuse me, it levels it back out. And they saw it as inevitable, or something that if I want a relationship, I'm going to have to experience a bad relationship because that's all I'm going to get. And it was really, if please, I do, encourage you to watch it if you can. But yeah, it was really quite moving, and unfortunately, that rings true to the work that we're doing, and we can see the same where people are seeing themselves, not worthy of a healthy relationship, and therefore are not feeling necessarily motivated to discuss it or to change it or to seek support for what they're experiencing. However, there is some positives coming out of this. One of which was an accessible definition. So as I've been sort of going over and mentioning about the use of our language and how that can be linked to different imagery that is not necessarily comprehending exactly what domestic abuse is. So a part of this research was about creating an accessible definition. So I shall read it out to you. If somebody very close to you keeps doing any of these things, hurts you, is cruel to you, threatens you, tells you what to do all of the time, takes your money, makes you have sex when you don't want to, it might be domestic abuse. So this is used as a tool to just start discussing these things, and introducing that term potentially. If we go into a room and say, are you experiencing domestic abuse? People will, 99% of the time say no, because either they don't want to admit it, they don't know how to answer that question, they don't know fully what that means, they haven't identified that what they're experiencing is actually domestic abuse, and they just might think that that's how it should be. So this accessible definition is a really, really good tool to use to start opening up and having those discussions. And yeah, it's something that I definitely implore you to use in your practice as well. I'll talk a little bit about the impact of abuse. We know Safe Lives, so they are the national data set. It shows that survivors with other impairments are significantly more likely to experience mental health issues. So 56% compared to the national average of 33%. And we also know that they are twice as likely to have previously planned or attempted suicide. So 22% versus 11%. So it has a real impact. As we know, it's going undetected. The people don't know where to seek support, and it's going on for far longer. So no wonder, and that's what the impact is. Equally, moving forward, we know that the physical health impact for domestic abuse is much worse for disabled people. So domestic abuse can negatively impact the person's abilities to manage primary physical disabilities and can lead to the onset of secondary conditions. So it is unfortunately a real predetermination for further health problems where there are already pre-existing issues as well. And then it also limits the person's ability to manage their health appropriately compared to other people with disabilities. So it really does have an overarching impact on people's lives. So what I'll do in my last, I believe, couple of minutes, I shall quickly go over what our project does in Cambridgeshire. So in Cambridgeshire, we have created our Shared Lives Domestic Abuse project, which is essentially tackling this issue that I've discussed with you. It's about identifying domestic abuse survivors who have learning disabilities and or autism and providing support for them. We know that, like I said, people are far more likely to experience this abuse for far longer. And the generic domestic abuse services just aren't structured to be able to comprehend the type of support and the long-term support that some of these survivors need or require. The absolute maximum, an IDVA, who is the person who you'd seek support with for domestic abuse, full stop, and the absolute maximum IDVA would work for somebody is a year, and that's where it's really, really extreme. And that's just, it's not enough for survivors with care and support needs. And so this project was established to be able to comprehend that, and also within the experience and the research that we found about domestic abuse, learning disability and or autism, people spoke about having this choice. I can either choose to have support for domestic abuse and have my experience as a survivor recognised and validated, or I can get support with my disability, with my care and support needs, with my autism. But however, they were never combined. You couldn't go to one place to get supported and feel comprehended as a whole entity and the whole experience. It was divided up, and so therefore this project is bringing the two together. So Shared Lives is a form of adult social care that's been established in Cambridgeshire for, I think, over 20 years now. It's probably nearer 30 than 20, but definitely over 20. And essentially, how the easiest way to describe it is like adult fostering. So you have a carer who opens up their own home and provides support within that home. So within this project, we have carers who are, with CQC registered, who are carers as part of our adult social care team within Cambridgeshire County Council. But they are also equally trained in domestic abuse and supporting survivors of domestic abuse who have learning disabilities and or autism, and so they're able to access this support to be able to comprehend the both at the same time. So the people using the support can be currently experiencing domestic abuse or have previously experienced it. We don't have a cap on how long ago that historic experience has to be, as any form of domestic abuse is it is valid, and those the impact of that abuse, as we can see, it can last for a really long time. So it's about that's the project really, essentially, as the crux. I'll skip forward then to this one. Essentially, so we are well within our year 2 of our project, but in the first year we created an interim report. essentially what we found was there was a general gap of knowledge within frontline professionals in understanding and recognising domestic abuse for people with learning disabilities. As our first year, we only accepted referrals for learning disabilities. In our year 2, we're now learning disabilities and or autism. And hence why we're here today as an effort to to spread the message. So we know this is a fairly new piece of understanding, and so we want to share that with everybody. We do know what we found again was that domestic abuse was being deemed as secondary in compared to the person's care and support needs. So that diagnosis, those care and support needs, were seen as separate and different in compared to their experiences of domestic abuse. They weren't seen as a whole, and they weren't seen to directly impact one or the other, which again sort of reflects back to Anne's case study, where actually it shows how that follows the person. They are very much connected. So year 2, we're accepting referrals for autism also, and we've also now explored other forms of adult social care to position ourselves again in a different way to be able to address survivors' needs and their support needs simultaneously. So just as a quick one, available support 999 in an emergency, National Domestic Abuse Helpline. These are really good people to call if you're unsure where your local support is, and they're also the people who you'd call if you were looking for a refuge. And then we have here the Cambridgeshire and Peterborough Domestic Abuse Service, obviously if you're within our area, and then obviously our Cambridgeshire emergency duty team. So I've got my contact details here on the screen. If you would wish to contact me, find out a little bit more about our project. I know I've sort of given it a whistle-stop tour, but yes, or if there's any discussions that you'd like to have about anything that I've discussed prior that you don't wish to bring up on the Q&A. And then that's our, for whatever reason, if I've got an out of office on, that's our shared lives email address there if you want to contact the whole team. However, I'm the only person on the domestic abuse side. So please just be aware to address it to me if you want that. But yes, so what I will do now is I will hand over to Anglia, and they are going to be sharing and discussing some case studies with you. So I'll stop sharing my screen and I shall pass over again.
Hello, I'm Andrea from Anglia. Thank you, Libby, that was fascinating. I've been busy writing notes so I can take it back to my organisation for the last hour. Fantastic, thank you. I'm just waiting for Claudia to pull our slide up, yeah. So, hello everybody, I'm Andrea Clark, I'm the CEO at Anglia, and we're based in Suffolk, but we work across the region. We work nationally with on some pieces of work, and we've been going for about 30 years in Suffolk. So we are an advocacy organisation. So we were started as what we used to call a user-led advocacy organisation, which meant it was led by people with learning disabilities. We now call ourselves a people-led organisation because, you know, people told us they didn't particularly like labels. We're all people, and we're all either workers or people that are not working, or volunteers, or people that are experts with experience. So we run advocacy workshops, we run advocacy groups, and we have an accessible information department, a co-production department, a health department, and we facilitate the East of England, NHS England co-production group. So we work with other advocacy organisations and parent carer organisations across the East of England to support the work that the NHS are doing to look at health inequalities. Okay, so another part of our advocacy work is the Suffolk Advocacy Service, and that's what we're here to talk to you about today. So that's the, we're going to present 3 case studies from the Suffolk Advocacy Service. So that's our formal advocacy service in Suffolk. So I've got with me my colleagues. I've got Kat Murray and Bridget, and they'll introduce themselves when they do, when they present their case study. So I'm going to start with my case study. Well, it's not my case study. It's from one of my advocates. Okay, so right. So first of all, this person, we're just going to call him D. Was referred by a social worker for help with the child protection process. D has global delay and is unable to read or write. He also has poor mental health. So when we do our case studies, we look at certain things. So these are the client issues and desires and desired outcomes. So the advocate met with D and his solicitor to discuss the court process for child protection. At this point, D revealed that he had another solicitor, as he had a criminal conviction for threats to kill, and this was also going to court. D explained that he had been in a mutually, sorry, I'm trying to read this, so it's quite hard because they're not my words. In a mutually abusive relationship with his son's mother, she had taken his money due to him being unable to read or write, and had left him to look after the baby while she went out with other men. The evening of the incident, she had brought men back to their shared flat, and he had asked them to leave. A verbal argument ensued. The police were called and D was charged with threats to kill. He was not on the tenancy agreement on their shared flat, and he was asked to leave the property. He was then bailed not to return there, which led him to him becoming homeless, and he was on the streets. Whilst he was homeless, he began to drink and take drugs, and mainly to help with the stress of him living on the streets. So the challenges. So what were the challenges to dealing with this issue, and how do we support the client? Or for you as the advocate, how do you as the advocate support the client? Because he was homeless on the streets, contacting him was very difficult. His phone was damaged or out of battery, and it was also difficult to arrange a place to meet, which would be safe for both the advocate and for the person. The advocate met D in a public library, and the advocate helped him to put in a housing referral, which resulted in him being able to in him being taken in by a housing-related support organisation in Ipswich. It was also a challenge to help with the child protection advocacy when D was homeless. The advocate did keep contact by phone and was able to send his questions to the social worker for the child in care review for his son. The advocate continued to meet with him at his solicitor's so that he could make a statement for court. So this next section talks about what support was given to the client, highlights examples of good practice or innovation that could inform the work, and the different techniques for communicating with the person and improving accessibility. So the advocate opened a new advocacy case for housing with D's consent, liaised with the housing organisation and helped him understand the emails and forms that needed to be filled in. For example, a duty to refer and an application to housing related support. The advocate kept in phone contact as D could not read. The advocate sent voicemails and texts with which the client used to translate. Then he sent texts back via Siri, or he made a call, or they met in prison. The advocate kept in contact with the solicitor and the social worker so that everyone had up-to-date contact details for Dee. The advocate accompanied Dee to housing appointments and solicitor appointments to help him understand what was being said. The advocate asked for Dee to have a court intermediary. So the things that went well, Dee explained that he had been in court for the threats to kill. He had not been jailed, but had instead been fitted with an alcohol tag. This had helped him stay out of trouble and succeed in maintaining the tenancy in his temporary accommodation. So the outcome of the advocacy support was that Dee is now safely housed. Dee has a housing support worker who can help with Gateway to help him choose and fill in forms for the future. There are also courses to help him with reading and writing. Dee has been fitted with an alcohol tag and is successfully engaging with the authorities and social care. Dee has supported from the probation service. Dee has helped to understand the child protection process. Dee understands that his relationship was mutually abusive. Dee says his mental health is better now that he is housed. So that's the end of my presentation, and I'll just introduce you to Kat Murray, who's going to tell you her case study.
Good morning, everybody. I'm Kat. I'm the Director of HR and Operations at Anglia. I'm also an independent advocate. I'm going to be talking about a gentleman who's experiencing domestic violence at home with his parents. A safeguarding referral has been put in, so he's eligible for statutory advocacy because he would have substantial difficulty engaging with the process. He's also unbefriended, so he's entitled to advocacy under the Care Act. This is a new case, so unfortunately I don't have any outcomes, but I'll read it to you so you can hear. So we're going to call him A. So A has autism and a learning disability. He lives at home with his parents, both of whom have significant health concerns. A is a full-time carer for his father. He gets up all through the night and provides all of his personal care. A looks physically and emotionally exhausted. His parents could pay for more support, but both have openly said that they won't spend the money. A feels trapped. Sometimes his parents lock him in the house and they get cross when he goes outside to put the bin out. If he goes to the shop, he must hold his mum's hand, which makes him feel awkward and uncomfortable as he's a 40-year-old man. A is frustrated and sad. He wants to be independent, but his father says he won't love him anymore if he doesn't stay and care for him. A has his own home in another town, but his parents won't let him live there. A has admitted to feeling so angry and frustrated that him and his father physically abuse each other, including headbutting. A has a part-time job, which he loves. It gets him out of the house for a few hours, but he relies on his mum to take him there. And often she says he's not allowed to go. A is controlled and trapped. He cannot live an independent life. A has enough savings to live a full life, but his money is in jeopardy. His parents are asking him to pay for boarding costs dating back to 2017. They claim is a total of £8,500. So that's the end of my case study. I'm going to pass you over to my colleague Bridget, who will give you her case study. Thank you.
Hi, I'm Bridget. I'm an independent advocate with Anglia, which is part of the Suffolk Advocacy Service. So my case study is for someone I worked with who we're going to call Kelly. Kelly was referred for advocacy by the social worker for her children who were on a child protection plan. Kelly has a learning disability. Kelly and her husband Chris were living in Kelly's father's home with their 2 children. They had previously lived in Wales and had had other children permanently removed from their care. Kelly had previously left Chris after experiencing domestic abuse from him and moved alone to Suffolk, but Chris followed her and they got back together. Whilst Children's Services acknowledged on the child protection plan that domestic violence had occurred, including an allegation of rape by Chris of Kelly reported to the police, as Chris was engaging in a perpetrator course, this was recorded as deeming to be sufficient. Chris was very convincing and plausible, and it appeared that children's services professionals had no real insight into how dangerous he was or had enough knowledge about how domestic abusers can operate. For example, getting women pregnant as a form of control. I was concerned that Kelly's father was complicit in the abuse, as when the rape report was raised at a child protection conference, Kelly's father's only comment was to respond that he believed that Chris was a good husband. There was no recorded recognition by children's services of this risk from her father, with whom the couple were both living. Kelly got pregnant again. Her 2 children were moved to foster care, as was her newborn baby immediately following her birth. Due to what Kelly told me during the course of my support of her, I submitted safeguarding referrals as it became apparent that Chris was coercing, bullying her into having sex when she didn't want to, and her understanding of consent in this regard was questioned. She then had a Care Act assessment, was provided support of an adult services social worker and an IDVA, independent domestic violence advocate, and a plan was put together to help her to leave Chris to move to a refuge. However, she never followed through on this plan. Throughout my support of Kelly, she failed to recognise that Chris was abusing her. Despite repeated conversations with myself and other professionals supporting her, she often made excuses for his behaviour and blamed herself. Months later, following an incident in which Chris put a BB gun in Kelly's mouth and threatened to shoot her, this was reported to the police. He was arrested, although ultimately the offence was no further action, and Kelly was supported to apply for a restraining order against him, and she ended their relationship. However, we are aware that Chris quickly went on to form another relationship with another young woman with a learning disability, and she has since also had his child. And that's the end of mine. Who am I handing back to? Claudia?
No, you're handing back to me. You're handing back to me.
Sorry.
Yeah. Okay. Claudia will make. Thank you, Bridget and Kat. And I hope the people on the call found that interesting. Claudia will share these case studies with you after the event, and
Yes, that's right.
Please get in touch with anybody at Ace Anglia if you need to speak to any of us. Okay, thank you. Right, am I going back to Tracy now?
Tracy.
Yeah, okay. Over to Tracy. Thank you.
So thanks everybody. I think we've had quite a interesting oversight of domestic abuse across a couple of areas. First of all, hearing about when someone has died and it's identified later, as well as hearing from Libby about the signs and symptoms. And I know, Claudia, have you got a slide to put up around this? And finally, just seeing some real life experiences of people with a learning disability and autistic people. Just waiting for the slide. So before we go on our Q&A, I just wanted to just do some recapping and just check that we've got out of today what you were hoping for. I think we've heard some really quite scary statistics from Libby, which hopefully you'll take away and be able to consider how that can be addressed in your own areas. It's just... Yeah, so I think that 1 in 10 disabled people having had abuse within the last 12 months really is quite stark. And again, all the other ones, as I've mentioned, that Libby picked up on, that the information will be circulated. So this presentation, along with the link to the recording, as well as the case studies that have been discussed by Ace Anglia, will all be circulated following this webinar. But just think on reflection, what we've heard. I think the different forms of domestic abuse is something that's still quite new to some of the things that we've heard today, not necessarily what we would automatically consider. And obviously then the impact that has on people with a learning disability and autistic people specifically. Hopefully people now will be able to recognise that abuse and the impact it can have on people. I think there was a really interesting comment in the Q&As from someone who just really, and it kind of resonates for the whole of this session, that, you know, we have normalised some of this, and people with a learning disability and autistic people, just that statistic of people not even knowing what the word domestic abuse actually means is something we really need to consider and take away. So as we go on, we've just got a quick Q&A, and actually we're 5 minutes ahead, so that's really helpful. We've got just a little bit of 2 questions to ask people. It's going to be a poll, so if you've got your cursor ready, we're just going to ask 2 questions. So the first thing, would you know how to assist a person with a learning disability or an autistic person once you've now recognised the abuse? So we can actually, if you could just click on yes, no, or somewhat, that would be really helpful. We'll be able to take that away, see what more needs to be done. So I'll just give people a moment to do that. Claudia, is people ticking in? Should we give it just a minute?
Yeah, I haven't, I don't see the results yet until,
right. Okay,
yeah.
Afterwards. Okay. So I'll just give people a little bit more of a minute. So are people aware of how to assist a person now that we've kind of heard from Libby and listened to some of those case studies, both the leader of case study and then following that, the case studies from ACE Anglia? Okay, so can we go on to the next question? You're able to turn it over. It's taken a while. Is it not clicking over, Claudia?
I think people can just press the next arrow, Tracy.
Oh, right, thanks. Yeah, so if you go on to your next arrow, that's helpful. Thank you, Anne. Because I'm not the technical one here. And I suppose the next one, if you can turn it over, it is about, are you aware of where you'd go for support in your own local areas? Because I know there's been a lot of questions in the chat. We'll pick that up in a minute. But I think locally in your own areas, it's that understanding is that services, are those services there for people? And so if you just let us know as well, that would be useful to know where people would know where to go. So I'll just give that a moment on the poll. Okay.
Yeah, I think that's
That's
still
time,
going. I think people can still respond when they can.
Okay.
So the poll is just on the right hand side, or if everyone clicks at the top where it says polls, they can see it.
Brilliant, thank
Okay.
you. So we're just going to take some time to go into a Q&A. We now have going to take the Q&A box down and put the chat up. And then obviously people can respond to chat. And I've obviously got our speakers alongside who will hopefully be able to answer any queries, or we can also take some away just to look into a bit more information if people have any other issues they would like to raise. So just picking up, Claudia, do you want to just take the polls, that poll thing down at on the page? But just picking up on a few things that I picked up on in the chat and the Q&A question box that I'll just go through. And I suppose the first ones go to Libby and to Andrea, and it was just about areas where areas which accept referrals into these services. I would imagine that every area from an advocacy point of view should have a formal advocacy service, but I'm not clear as to, from Andrea's point of view, how well that's supporting domestic abuse. So maybe you could pick up. But Libby, do you want to just explain the referral process?
Yeah, absolutely. So I'll say this sort of, is a little bit maybe big-headed. Cambridgeshire are really lucky. Cambridgeshire, this project is the only one of its kind nationally. So when it comes to anywhere else other than Cambridgeshire, I won't lie, it is a bit sparse. This is the issue. We know that nationally there's only one refuge in the entire country that is specifically for people with learning disabilities and or autism, which is why in Cambridgeshire we are establishing this project, as there is a dire need for specific services for these experiences. Within our project, we cover Cambridgeshire and Peterborough. We do also have a couple of out of county placements as well. We do have one in Suffolk. However, they were Cambridgeshire children from fostering, and then we've supported them afterwards. So there are different routes in. Essentially, our project is a bit twofold, really, in the sense of we're providing support for those who have had experiences of domestic abuse. However, at the same time, we are establishing a new support service. So we have ongoing recruitment of shared lives carers as well. So essentially, if we have shared lives carer in that area, then we will be able to provide support in that area. However, if anybody's ever encountered shared lives before, but have shared lives before, it is always a bit of a balance to get that correct. It's either you have too many carers and not enough referrals, or vice versa. However, we are actively recruiting more carers ongoing as a part of the project to get bigger and bigger, and so therefore we're hoping to be able to give more options and a wider pool of places that we are able to support. We do have carers on the Norfolk border, so again it depends on the specific person's experience and where they live as well. If it's historic, then we're obviously less bound geographically as to where they can have support. If the support is ongoing, then we're going to have a little bit more of a look into the location of the support to make sure it's safe for everybody involved. Yes, so Cambridgeshire currently, unfortunately, there aren't many specific services for this in the country.
Okay, I've got Kat and Bridget as well, because they're both practicing advocates. So we've got the Suffolk Advocacy Service in Suffolk. So, but I think what we do is we pick up these things as we're doing them, rather than them being referred to us as domestic abuse. But if you can ask Kat and Bridget can say whether that's, I think it's about finding them in our self-advocacy groups and just by talking to people. But we're lucky in Suffolk that we have a good self-advocacy service and a good professional advocacy service, so there's more chance for people in Suffolk. But we know across the region that there's not always self-advocacy across the region, which is something that we're campaigning for in the regional group. Yep. Okay, so Kat, Bridget.
Yeah, so shall I go first, Kat?
Yeah,
so
you go first.
For example, I've got a mum that I'm supporting a new referral at the moment, and it doesn't come in as a domestic violence issue. It came in as children. She wants it was a social worker for the children who referred her, and on meeting her, there was it wasn't flagged up that she was in a domestic, or had just finished actually a domestic abusive relationship, but she's still living with him in the home. But I hadn't got that information, so I went and met her, and he was there, which obviously if I'd known that before, I wouldn't have met her with him there. And it was only through conversation with her and then subsequently seeing her on her own that I've realised that there is domestic abuse in that well, it's still a relationship because they're still living in the home, although they're not actually in a relationship together anymore. So a lot of the time you're just having to unpick, as an advocate, you're unpicking a lot of stuff. So the identifying issue or the referring issue leads on to multiple other issues that you may or may not end up supporting with, depending on whether it fits our remit. But for this mum, so in the process of referring her for an IDVA, so she'll get that support. And then there's multiple other issues relating to our housing. He's on the tenancy, all of that kind of stuff, which is beyond the advocacy remit, but I'll signpost, hopefully, to services that can support her to resolve all of that.
Yeah, we come across domestic violence, as Andrea said, through our groups, through meetings, through employing people with learning disability, through our statutory advocacy, through our professional advocacy, non-statutory advocacy. We come across people that say, for example, that they're not allowed to use their Motability cars, that their families have ownership of the cars. That's part of financial abuse. We come across that a lot. We come across people being controlled, and like Bridget said, they often don't understand that it's a form of domestic abuse. So we're unpicking it. We would, like I said when I mentioned with my case, people who are referred under the Care Act, if it's a safeguarding referral for domestic abuse, that's when we'll get a referral through. So yeah, I don't know I hope that answers the question, Tracy.
Yeah, no, thank you. And I suppose the importance of independent advocacy is kind of the first direct location to go to across the region. There will automatically be statutory services available there. But obviously, I think it's been highlighted that Cambridgeshire is very, very fortunate to have a service specifically to support people outside that advocacy activity. So just to kind of pick up, I'm going to pick up on Anne. I think, Anne, it'd be really helpful. There was a question in the Q&A around how can, in a consultation room, how do you feel from a health professional in a consultation room we can support people with a learning disability who it might be identified with domestic abuse with the abuser there? How do we think we can support that to get that person in?
I think this is really about being led by the situation, and on the one hand being prepared to think the unthinkable, so that you need that radar to think, is there something that's amiss? And you can ask the carer to step outside so that you can ask the person with a learning disability a couple of questions. If the person with a learning disability is able to express their needs, so that you can ask them a question, whether they would mind the carer stepping out, I think is really important to address your questions to them first. But I think there's also something about triangulating information so that it's not just in this situation. If there is something that you're concerned about, whether there can be a follow-up phone call, a follow-up home visit, anything like that, that you can step outside of that situation. But it's really important that if you are concerned, that you escalate that concern, talk about it with your manager, think about how you might approach it differently. But for the most part, you would expect a carer who has that person's best interests at heart to respect the need to ask some questions without them present. But we also recognise that people with a learning disability need a support person, so they're present. So it's a tricky situation, but it's about getting in touch with your learning disability nurse colleagues. The community learning disability nursing team are a great resource in this situation, because they may be able to be involved in that situation and maybe accompany a consultation. But don't leave it. If there's anything that you are concerned about, please just note it, escalate it to your manager, discuss it, and explore the issues. And if necessarily, that needs to be a safeguarding referral if you are concerned.
That's great, thank you, Anne. There was another query in the chat about that somewhere's got some really good domestic abuse services in their area, but we're not sure how well they're supporting people with a learning disability or autistic people. Just as a commissioner myself, I suppose, looking at that from an outside point of view into services, I think it's really important that we look at contracts, people's services that are already in existence, and reasonable adjustments needs to be in there. It needs to be under the Equalities Act that any services should be made available to people with learning disability, autistic people, through a reasonable adjustment. And those services which are already commissioned need that training to be able to know how to access services, so access those people to be able to provide the right service. So whilst we might not have a very specialist domestic abuse service in the same way that Libby provides, it is really important that we address that reasonable adjustment issue. Alongside that, obviously, I'm sure a lot of people will want to contact Libby to find out more about their services and then go back to their own commissioners to look at how that can be expanded. And again, likewise, their statutory advocacy services. So I think there's a number of routes to make sure this is being addressed locally. And I think I urge probably everyone in their own ICBs or local areas to kind of consider that. I think it's interesting, Libby, where your funding comes from, because it's from Police Commissioner, isn't it? And that, again, we kind of always look at social care, that direction, but actually there's everyone's responsibility. So the funding could probably be identified in a number of places. Andrea, I'm going to put this one to you because it's been a while since I worked in social care, but do you have, can you explain the eligibility under the Care Act for advocacy?
I can't, but I'm sure Kat will.
Yeah, I will. So the person has to, you have to tick all 3 areas. So the 3 areas for the person to be eligible under the Care Act is that they would have substantial difficulty being involved in the process. They have no one appropriate and no other family members or friends that would be appropriate to support them and consult with them. And it would be for something like a needs assessment, a carers assessment, safeguarding, or a review. So, but you have to have all 3 boxes ticked to be eligible for that. So, but we do support people through community advocacy, so non-statutory. So it wouldn't be that we, we'd say, right, that's it. It just might not be that they're eligible under the Care Act. Okay, thanks.
That's great. I'm trying to look at new ones that have come in. Just checking my questions. It looks as though there's a lot of people asking for any resources that people developed. And I suppose the call from my point of view is if there are other areas where domestic abuse resources have been developed in your own areas, then do send them over to us, because I think it's really important that we do share those good practices in other areas as well. I don't know from a point of view, Andrea or Libby or Kat, Bridget, whether or not anything has been created that can be shared around supporting people, but we can also look into that and see whether or not there's something that can be circulated. I don't think this is why today's really important. I don't think there's these kind of things available, but now that we've brought it to attention, hopefully people will go away and maybe consider that and the importance of it in their own areas. So but Libby, if you've got anything that would be helpful, particularly around your stuff.
Yeah, definitely. Like you said, unfortunately it's all quite disconnected because this is all relatively new when we're talking about these sorts of things. However, within our scheme in Cambridgeshire, we have developed a generalised healthy relationships and friendships practice guidance. So starting at the root, actually about how we can positively encourage and support people to enter healthy friendships and relationships, and how we manage that within adult social care. And obviously then that touches on, of course, on how to identify when that is unhealthy. So that can just be a helpful general guidance, full stop. Really, when it comes to more specific stuff, I have lots of resources about the project specifically. So if anybody is interested in what this support can look like in other areas, please, yeah, get in touch. Yeah, we are quite lucky in Cambridgeshire that we do have this sort of specialised service. And yeah, I used to work in more generalised domestic abuse services before this project, and yeah, they are fabulous, and they are also commissioned to provide support for everybody. I know specifically in Cambridgeshire we have health advisors for people who have, again, health considerations as well as their domestic abuse, and they are placed in hospitals and everything, so they are more accessible. However, there's always limitations, aren't there, to support services. And I think for generally speaking, for domestic abuse services, it is the time. You can't support somebody forever, as unfortunately there is so much abuse going on. There are so many people with really high risks. You can't work with everybody forever, and therefore that's where these sorts of services, these more long-term approach services, really do come into play.
Thanks, Libby. Going over to Andrea.
Well, we cover we cover healthy relationships in our women's health workshops that we've been doing now at ACE for 2 years. But it's interesting that all our case studies were had men in them. So and the men in Suffolk are asking for some workshops so that they know about what is a healthy relationship, because it's just something that in kind of our experience at ACE that's just not discussed with people anywhere. So and in the women's health workshops, we find some dreadful things where, you know, like some young women in their early 20s don't even know what their body parts are. Well, then that makes them very, very vulnerable to know that if somebody's doing something to them that they don't want to happen. So those kind of things happen for us. And I think we've got an opportunity, because we've got another regional co-production group, Tracy, so we could ask that question there if anybody's doing anything in their area. We could try and gather some information for you there. Okay, thanks.
Thanks, and I'll go to Kat.
Hi, yeah, this is in response to one of the questions about organisations that support people. I did phone the National Centre for Domestic Violence last week and asked whether they had a specific arm within their charity to support people with a learning disability, and they said they didn't. And I said, could you recommend anywhere that I could try? And they just said, try Men's Aid, try Women's Aid. So there's very, very little knowledge and support that I've been able to find within the region, which I think is a real shame. So
it is. So I think we've got some action to take here. I don't know as well whether you've got services which are commissioned. I think most of them possibly be commissioned by public health, maybe, or social care. And I'm just wondering, Andrea, as a lead provider of the Oliver McGowan mandatory training across our region, with learning disability and autism, would the Oliver McGowan training fall into that as a training module for domestic abuse services, or?
I think they're still deciding in Suffolk. At the moment, we're just training mostly health professionals. So unless they're working in that area, then but we are trying to open it up in Suffolk to social care and social care provider organisations. So that might be when it starts. We start seeing those people coming in to do the Oliver McGowan training. As you know, it's going to take a long time to get through all those people, and we're still battling through health at the moment. Okay, thanks.
But it obviously shows a need. It definitely identifies that our existing services also need training. So maybe again, that might be something that needs to be identified in contracts.
We have trained the ambulance service, so I'm guessing some of those ambulance drivers may see people that may be possible victims of domestic abuse. So those are the connections going out into the public, and obviously doctors' surgeries and things like that. Yeah,
that's brilliant. I'm just trying to go through. Interested to see what statistics look like for BME or LGBT, since we know intersectionality is poorer experiences. I don't know. There was a question also with the case studies being about any autistic people without a learning disability. I suppose both those, Libby, because quite often when we see intersectionality of BME and particularly LGBT plus is around autistic people maybe without learning disability, without generalizing. We do see that a lot through Leader, and we see that a lot through just a lot of services that provide diagnostic services. Have you got any other case studies you might be able to just put one together of an autistic person without a learning disability?
Yes, I I can't specifically say about autistic person without learning disability, as there wouldn't be any outcomes. It's sort of ongoing. However, when it comes to LGBTQIA plus, we have actually found a theme whereby it tends to be family abuse, where the survivor identifies as LGBTQIA plus, and it tends to be a father figure, male, senior to the person, and they are abusing that person, and we can see it has very, very strong links to that person's identity. So yes, it's definitely something to consider. We are seeing that as an ever increasing risk factor in the people that we're supporting in Cambridgeshire.
Okay, Vicky, yeah, we'll go away and try and find some and look into that around the autism, because I'm sure even if we haven't got the outcomes of it, it's good to be able to identify when it's happened. We also work very closely as our other regional partners, whilst ACE works with, we work with ACE for autism and for learning disabilities. We also have a partnership with Autism Bedfordshire for the region, and they couldn't come today to also give case studies, but they might have one that we could also share. Again, looking at autism without a learning disability. Just, have I missed any? I'm just trying to check. Obviously a lot of people want resources. Go on. Who's have I missed?
Sorry, I've just seen there's a question that was in the Q&A and in the chat as well about household abuse and how it's not considered domestic abuse. I don't know, Libby, if you could share some light into that. I don't know if you saw the question.
Yeah, so it is a bit tricky, and because we have to essentially, we're all commissioned to work from the definition that was established in 2021 from the Domestic Abuse Act. So therefore, if that person's experience doesn't fall within that category, domestic abuse services are limited in what they can do. And that's not trying to invalidate anybody's experience of what they're happening, because I can imagine if you had a housemate who you've never had an intimate partner with and you weren't related to them, that can be just as, the impact of that can be just as severe as it would be elsewhere. However, yes, unfortunately, I think it depends on, it will depend on each service as they come. Some domestic abuse services have maybe a little bit more leniency towards supporting people than others. However, generally speaking, no, it wouldn't fall under that category. So you'd go to more generalised support services like victim support, and so they'd still be able to support that person. It just wouldn't be necessarily a domestic abuse service. Equally, sexual violence, sexual abuse is sexual abuse, so it doesn't matter who it is from at all. So if there was sexual abuse involved, it's irrelevant of the relationship, the predetermined relationship with that person. So they would be entitled to any support there. So ISFAs, and you'd be able to go to your local SARC centre as well. But however, yeah, with domestic abuse, there is that little bit of contingency there with the definition, but you would go to other generalised services like victim support to help.
Thanks, Libby. And just one other query, is your service only for people with autism who've had a formal diagnosis, or do you take people on the way? Yeah, okay.
Yeah, and it would need to have a formal diagnosis, as we're CQC registered, essentially. So we're part of adult social care. It would need to have that, yes. However, we do accept referrals from any professional. So it can be from a doctor, a nurse, it can be from a social worker, it can be from IDVA, a therapist, what have you, as long as you are a professional working with that person. Generally speaking, if we can get the support funded through that person's current support package, then we will. But if we can't, then we will still support them and we'll seek funding elsewhere.
Brilliant, thank you. And sorry to put you on the spot, Kat, from a point of view then, going out to statutory advocacy, that would probably be the alternative. It doesn't have to be someone who have a formal diagnosis of autism, they just have to have an identified as themselves as disabled, is that right? Or having in line with the Equalities Act, would they be able to have services without a diagnosis of autism?
Yeah, so as I said, with statutory advocacy, so that's advocacy under the Care Act, they would have to have substantial difficulty engaging with the process, whatever that was, whether it was an acquired brain injury or whether it was a formal diagnosis. But like I said, we do support people through our community advocacy. So, you know, we would pick up and support people at whichever way, whether it was a statutory or non-statutory referral, and whether they had a diagnosis or not. So
thank you. So we're at wow, 5-1. I think we've had, unless anyone's got any other questions, I think one thing I'd just like to say is just to also be mindful for all our colleagues who are involved in LEADER, which our Learning for Lives and Deaths programme, just to be mindful of any reviews you're doing, that actually that might also be identifiable within your reviews, and it's really important that we pull that information out to gather the learning and then to create change. For all those that are commissioners or involved in services, really think about how you could involve services such as Libby's, or use your self-advocacy, statutory and community services more effectively to be able to make sure that they are that they can support people. Making sure those existing domestic abuse services that are commissioned know about learning disabilities and how to support people. I think that's possibly kind of bringing it to an end, but I'll let Andrea just have a...
Yeah, somebody in the chat asked if we supported people in Hertfordshire. No, we don't. But there are advocacy services in Hertfordshire. There's Power Run Something, Independent Living Service, Hertfordshire Independent Living Service, and I'm Googling all this as we speak, and Voiceability. And there are also a self-advocacy group. But we do work with the self-advocacy groups from Hertfordshire in the Eastern region, co-production group. So that's answering that question.
Good. And I think everyone is always helpful to know what your local services are like anyway. So from me, as the lead for the region, and on behalf of our speakers, I'd like to first of all thank our speakers for coming, and also being able to present, and hopefully you've taken away some really useful information. And we will have other LEADER Learning from Lives and Deaths webinars coming up. But hopefully this has been informative. So thank you for attending and have a good day. Do you just want to stay on, Andrea?
thank you.